Okay.
Okay.
Hi. First of all, nice to meet you.
Nice to meet you.
My name is Penny Leifer.
Pleasure.
So we'll just go through a few things. Let's see how they'll sound.
Sure.
So, good morning, Dr. Katz. Welcome to Barbara 24's office. We truly appreciate you taking the time to be here with us today.
My pleasure. Thank you.
As President and CEO of New York City Health and Hospitals, you've had a tremendous impact on healthcare across New York City, from expanding across through New York City Care, and basically to strengthening the entire hospital system, truly improving emergency response and guiding the city through its challenges. Your leadership has directly affected hundreds of thousands of New Yorkers, and this includes many in our community. Here in Borough Park, healthcare is something people really and deeply care about, especially when it comes to institutions like Maimonides Medical Center, which serves as a lifeline to so many of us. Now, we know there's been a lot of discussion, concern and speculation in the community regarding the possibility of a city takeover or not a takeover of Maimonides. People want clarity, first and foremost, I think. They want to understand what's happening, what it means for the patient care, and what the future holds in regards to that. And today is an opportunity for our community just to hear directly from you. We would like to discuss. Let's begin with what exactly is being considered regarding Maimonides.
Sure. So, the first time I was in Maimonides, I was 10 years old. I was visiting, my aunt who was hospitalized there. So, like every sort of Brooklyn kid, Maimonides was like the hospital on the hill. So when I was approached about the city helping Maimonides, I of course wanted to be of help. What I've learned in the greater process is that Maimonides has been looking for a partner for more than 10 years. And the basic reason is that it's almost impossible for independent hospitals to survive in competitive markets like New York City, which is why almost all the hospitals have joined some larger system. Maimonides was due to join Northwell, and for a variety of reasons it didn't happen. And so they have since been looking for a partner. And during this time, the share of patients who have government insurance of Medicaid has grown. And public entities like New York City Health and Hospital receive higher rates of reimbursement for Medicaid patients because we take care of so many uninsured people, and because the city can make the match that is required under Medicaid. So Maimonides and the state approached us on whether or not we would help Maimonides, and as a Jewish boy from Brooklyn, I said, of course, if we can be helpful. We don't need to do it, in the sense that the deal has been constructed to deliberately to make sure that there is no benefit to health and hospitals. Whatever increased money that we are going to get from Maimonides will stay at Maimonides. And that was important to me because I didn't want anyone to think I was doing this in order to help health and hospitals. This is purely about Maimonides. So to what exactly is happening, the plan is for the hospital to transfer the operating certificate to the city. But all of the employees will continue to work for the residual Maimonides. So one of the concerns we've heard is we don't want city workers. Well, I have good things to say about city workers, but they're not going to be city workers. They are going to remain employees of the nonprofit. The doctors will be in their own independent PC. They will not be employees to the city. So on day 2, nobody's going to notice anything. The two big things that are going to happen is that all of a sudden Maimonides is going to get $9 million more per month for doing exactly what it's doing now. And we will give Maimonides a modern computer system, which they currently do not have. More or less, that's the arrangement.
Just a bit in short, follow up on that. I would ask, as I've said, people are looking for clarity. So would you call this a full-on takeover or not?
I definitely don't call it a takeover, because when you take over implies that you want something. I'm taking your assets. That's not what this is. So New York City is Health and Hospitals is a federation of hospitals. Each of our hospitals has a different tradition. Bellevue was created prior to the signing of the Declaration of Independence. But Bellevue is a very different hospital than Elmhurst out in Queens. Maimonides will become part of our system. The operating certificate will be the city, but the way that it will be operated will be very different than the way the other hospitals are operated, because the doctors won't be working for us, and the nurses and other unionized staff won't be working for us. And what the name isn't going to change. What people will see is the hospital they've always seen, except that we're going to be able to fix it because there's enough money. Our first priority is to redo the maternity ward. There are 6,000 births a year, and anyone who has been in the current Maimonides maternity ward knows how inadequate it is. So that's our first priority, is to renovate it. Right now, if Maimonides stays independent, there's no money to renovate it. If we join because of the grant the state has given to this process, there will be a brand new maternity ward. So the things we have committed, we're not going to change any of the things that people believe in. All of the respect for the Jewish traditions will remain. But now there'll be enough money to run the hospital without the kinds of deficits that the hospital has had historically.
Now, as you just said, the name won't change, but in regards to that, what could residents expect to change?
Hospital will have better facilities and better staffing, because our involvement will bring in more dollars for doing the same thing Maimonides has always done. And that's why, initially, change is always hard. And initially, we heard a lot of concerns, starting with the doctors. And everybody said, if all the doctors leave, this is not going to work. And so, all of the doctors now are happy, right? And they're not leaving, and they've made very clear that they're not leaving. And then, we've heard from, at first, many community groups were worried, or unions were worried. And each time, as we've sort of explained, it will still be Maimonides, it will still follow all the same things, but now it will be adequately funded, right? Adequately staffed. The doctors talk about trying to see patients and having no support staff. And it's not anyone's fault, but there's not currently enough money. And if they stay independent, there won't be enough money. There won't be a renovation of the maternal ward. So, and when hospitals don't get renovated, then fewer and fewer patients come who have insurance. And so that makes the mix of patients even harder and harder to maintain.
Let me ask you what I think
Sure.
is the most important to our viewers, which is how would this impact the direct care of our community?
I don't think anybody will notice anything different other than a new maternity ward and better staffing. We're not all the doctors have committed to staying. It's going to be the same nurses, the same social workers, the same name on the building, the same building itself. They will discover a modern computer system. It will take about 15 months. But something our community is very good at, of course, is use of technology. When you have, with our Epic system, when you're in the hospital, you can follow your daily progress on your telephone. You can see all of the labs that have been ordered. You can read the doctor's notes. There's no in health and hospitals today, many times people feel like perhaps the doctor's too busy because they don't have no one's come in and told them what the result of the CT scan is. Well, you'll see on and this is today at all our hospitals, you actually see the results at the same time your doctor does. No waiting. You can text your doctor on your telephone. Right. So, I mean, I think this community particularly appreciates and knows how to use technology. You can give your family the right to follow your hospitalization while they're at home. So if you have an elder who perhaps really cannot follow their course, the son, the daughter can follow it at home on their telephone. So, I mean, a modern computer system, I mean, again, talk about, borough park community, you have a hospital where some of the doctors are charting on paper. I mean, I charted on paper, but 20 years ago I charted on paper. I wrote prescriptions on paper 20 years ago. I haven't done that in 20 years. They're still doing it. And it's all because under the current arrangement, there's simply not enough money. So I think people will find that they have exactly the same hospital, but that all of a sudden now it's being renovated, it's adequately staffed, and there is a modern electronic system. I think once this happens, and change is always hard. Once it happens, everybody's going to be like, what were we worried about? Everything looks the same. It's the same hospitals, the same doctors, the same ambulance service. But change is always, whenever there's change, people say, well, what will this mean? And what if it's not the same? So I certainly understand it.
So on to the next concern. Well, a lot of people, probably most people think in their minds, it's no secret that Hatzolah, the Jewish Humanitarian Organization, has open doors probably like no other hospital in the entire city system or elsewhere. Maybe in Israel, like the doors are open, the trust is on both sides. It's a benefit for both parties. Many people are concerned once the city steps in, protocols will have to be more taken in place and put in place. What will be with Hatzolah?
So we've had multiple meetings with Hatzolah. They are supportive of us. They bring patients all the time to South Brooklyn and to Woodhall. We'll have the same policies. From my point of view, why would you ever be opposed to people who are helping to bring in patients? And what's different about their orientation is they're not just bringing you the patient, but they're also advocating for the patient, and that leads to better care. So we've been clear, nothing will change about the relationship with Hatzolah.
I saw a letter they gave out. They were against this whole process.
But you have to talk to them now. So it's not the same as so absolutely in the beginning. And again, the same is true about some of the doctors. But that's changed. I think it's just the process of people actually, learning about what we intend to do in terms of improving things and not changing the things people don't want changed. So if you check with them now, I think you'll get a very different answer. I've met with several of the different
leaders.
The Flatbush, the Hatzolah Flatbush, the Hatzolah Borough Park. We met together. Would you agree with my characterization that initially people were from Hatzolah were against it, but they have changed their minds?
Correct. We met with Central Hatzolah, which was his older day.
They were incredibly supportive, wished us well, understand again. Our whole goal, and again, you have to go back to your first question about, what is this? We were not seeking additional hospitals, right? I run 11 acute care hospitals, 4 skilled nursing facilities. We were fine. We weren't. This was because someone correctly articulated that if the city took it over because of the way the Medicaid match works, we could bring them in more money. And so from my point of view, we're not going to change the things that are working. We just want to help to make sure that the hospital is adequately funded.
Many people are worried this is a bigger I don't take over from your side, but the way Ken Gibbs is leading his game. one of the things I was told that the mission statement of the hospital that was like since the founding, I don't know, 100 years ago, I don't know how many years ago it was that they're here to serve the Orthodox community, while they actually serve everyone equally. Well, that was like the mission statement, that's why it opened. It quietly just changed over the last 5-6 years. And while we want to treat everyone, this is like concerning what is happening behind the doors. And if this is part of something we should be concerned of.
Yeah, I've heard this history, and of course I wasn't part of the history, so I don't really know. It has made the whole thing more complicated. When I was first approached, what I was told is that the Orthodox community greatly supports Maimonides. Well, I think that's true, but they don't all support the way it's been currently administered. And so it's become a little bit more complicated, right? So not everybody is in favor of the way it currently is, which then makes the messaging a little bit more complicated, because when I say, well, I started with their line, which is let Maimo be Maimo, right? But then again, we're a complicated people. And it turns out that when not everybody wants Maimo to stay Maimo, if what that means is the way it is today. So we're trying to figure out, we want to be what the community wants. We are an organization that is based on cultural competency, and you always have to take care of whatever the population. That's why Bellevue and Elmhurst look completely different, because the surrounding communities that they're trying to take care of are completely different. And the same will be true of Maimonides. It will reflect the people it's taking care of.
I was told that in the meeting with our community leaders, the doctor promised them, I think it was a year and a half ago, that nothing will be changed without discussing and getting the okay from the same community leaders, those who are now against us. So they're like concerned, where did that go?
Well, the what I understand that one of our traditions that in my family we respect is the different ways to light a menorah, right? It's a majority opinion that you increase the candles, and in my house we also do the decrease the candles, the other way. And to me that's an analogy of our community, right? I don't have to agree with people, I can still respect their opinions. And when I have talked with members of the Orthodox community who are opposed to this, first, they're not opposed to me. They're very respectful and kind to me. They recognize that we have completely changed health in hospitals. And what they say is that, this is a hospital that was built by our grandparents. And we do not agree with the idea of turning over the assets to the city. I understand that. But I can't change that. And I don't see what the alternative is, right? I don't think that a good alternative is to continue a hospital that is charting on paper, that has inadequate staffing and desperately needs capital improvements and doesn't have the money. So, I have said all along, if there's another viable plan, I'll help you. Come up with another viable plan. We did not get involved in this because we need another hospital. So if somebody can tell me how you're going to adequately fund the hospital, instead of living, day to day. The other thing that's a little bit ironic is that Maimonides has become a public hospital, right? The only difference is that the decisions are currently being made by the governor's office in terms of how much money they have to bail out Maimonides on a week-to-week basis. So actually, and the vast majority of the patients are on Medicaid or Medicare. So this idea of government hospital, I'm not really sure in this context what that means, at least where the government in this case is a lot closer to Borough Park. It's a lot easier for Borough Park to influence City Hall than it is to influence, the state. But regardless, I am still, if there is another alternative, we have said all along, we are happy to help make that happen.
One more question. I don't know the exact document identity, everything, but I was told that there was one of the documents there was a promise that nothing, the services we have now, the Jewish community, won't change, will never change. That was over the time changed to the next 30 years. Over the next 30 years, you probably know better than me to what
Right.
they're referring to. What?
Well, it's the only line I've always had is that I don't want to say that nothing will change in perpetuity because only God is perpetual. It's hard to know what there are things 30 years ago we don't do anymore in healthcare. So I did not want to be I didn't think that it is sensible to say that no medical services can change, right? We may decide in 30 years that we don't want to ever do CT scans again because MRIs have gotten so much faster and they don't have radiation. So I don't want somebody who has an odd preference for CT scan to say, well, we used to have CT scans and now you've taken away all the CT scans, right? I mean, there is always someone with an unusual opinion. I mean, I see that today. In fact, we are having, without going into it more for your amusement, we're having an argument with a surgeon who believes greatly in one type of surgery that she does that nobody else thinks is a correct surgery. But she swears that this surgery helps people. And, when we went and said, no, this is not considered modern things, she said, well, you call the patients and you tell them that they're going to be harmed by things change, right? I mean, it's so, to say the Jewish traditions will be in perpetuity because that's our people. But I'm not prepared to say that we'll never change a medical procedure.
I want to ask you a question that is something that is very important to our community. In Jewish law, the final moments of a life are handled with great care and dignity, and there are specific religious requirements, I believe you know. Families place tremendous importance on ensuring that everything is done according to halacha, often with guidance from Rabbanim and with the involvement of organizations like Chai Aruchim and more. With all the discussions surrounding Maimonides and its future, many are concerned about whether these sensitivities will continue to be fully respected. Can you address how end-of-life care, especially when it relates to the religious needs of our community, will be handled going forward, and whether the current level of cooperation and accommodation would remain in place?
Yes, it's a simple yes. And we have done it in smaller numbers at Woodhall, which has the Crown Heights population. So we understand, and again, this is part of our DNA, is that different communities have different rules. And usually birth and death are the most intense places where those rules exist. And we will obey and follow. Again, while I am not Orthodox, all my in-laws are Orthodox. I know all of the Orthodox rules. I understand the differences, between a Reformed Jew like me and the Orthodox. I start from a position of cultural competency. And in this case, cultural competency means following, rules that are more than 5,000 years old, right? And that have to do with, how we believe things should happen at the end of life. It's not going to change. And again, we have obeyed it at other hospitals like Woodhall, where we have cared for people at the end of their life. It's not going to change.
And thank you so much,
Well,
Dr.
thank
Katz,
you.
for taking your time with us today. We really appreciate it.
My pleasure. And we appreciate anything that helps to get out the